But thank you all for being here. The reason why I wanted to take a few minutes to share a little bit about a situation that I think that the community really needs to understand, that there's a number of seniors in our community that have limited access to care. And I want to tell you why. First, as I've understood the situation, we've tried to drill down to find out why do some of the people that really are the most ill in our community need the support from an outpatient level of care, aren't able to get that level of care. And let me outline that for you very quickly. The first part is that there's 3 different systems that a senior who's age 64, turning 65, gets involved with. Social Security is one of them. When somebody turns 65 and they apply for Social Security income, SSI, that would qualify them for the full state benefit for Medicaid. But the problem is SSI is a federal program and Medicaid runs through the state system. So there seems to be a little bit of a gap in being able to qualify people, some people, to be able to be fully qualified for the full state benefit that covers the entirety of case management, psychoeducation, and therapeutic services. Another potential gap is that the way that we apply for Medicaid for an individual is in a categorical way. One is like old age pension. If you apply for financial and you don't check the boxes all the way across the form for the medical support, you may actually not be evaluated for what level of Medicaid you qualify for, because the 2 systems are evaluating a little bit different. Those 2 may be outliers. The third issue is probably the most prevalent issue that causes challenges for individuals to access care, and it's called the 5 questions. And as I was sharing with somebody in the audience earlier, one of the questions that's asked of a senior, can you manage your needs independently? Well, most seniors are going to say yes. I will tell you, if somebody asked me, I would say yes, but if you drill down a little bit further and ask, can you manage without your wife? I'd say, well, hell no. This is being recorded, sorry, Tommy. Anyway, I couldn't. But this would be an example of where a senior may not really understand the 5 questions, which means they may not fully understand the way they respond may kick them out of the eligibility for some of the benefits that are available to them. So that is the issues that I think are the issue for those that are 65 to about 72. So if somebody declines to the point where their level of illness from a behavioral health perspective is so complex, then they move into inpatient level care or some other higher level of care. Now the good news about that, that's a funded resource that you can draw Medicare from. You can cover that level of care. But the problem is if you step back and you think about case management, psychoeducation, advocacy, all these codes that were available to that same individual at age 64 are not available to that individual when they turn 65. Nothing's changed with their income, so the eligibility is still potentially there for them to be available. So we've got to be able to move the system forward to be able to help them procure benefits. In the packet that I have, and there's others up here, I just want to outline for you, I'm not coming here to slam the federal, state, local, county, none of those systems am I saying shame on you, blame you, or anything like that. What I am asking for is your support to think about helping a collaborative entity in NAMI, Colorado Springs Fire Department, Silver Key, and Innovations in Aging to move forward with an application. We're moving forward with a Next 50 application, and they have what's called a $1 million idea. The $1 million idea is to be able to have something that has a filter of being able to be innovative to solve an issue so individuals are able to live independently as long as possible in their own homes. Second thing is it has to be scalable. Whatever solution we put out there has got to be something that could be adopted at other communities, other counties within the state of Colorado. It has to be, again, replicable, and it has to be able to be sustainable. This is what the proposal that I'm bringing forward to this group here and everybody online. If we were able to take this concept and be able to say that we have 2 years of funding through a $1 million foundation grant that would allow for us to be able to understand when we move from NAMI support about mental health first aid for older adults to be able to educate the community about recognizing signs and symptoms and moving individuals to a case management therapeutic support on the outpatient side, that's part of the solution. The second part is to be able to have case management and prevention, early intervention support in that next group. That's what Silver Key would be bringing to the table. It's already a core competence of Silver Key to be able to provide that care. The third area is to be able to bring intensive case management and wraparound type of care for older adults. The Colorado Springs Fire Department, with their response system, is where they come into the collaborative. The intent being, for 2 years, what we will do is we will take that model, a system of care model, we will step back, and then with innovations in aging, I'm hopeful will be part of the collaborative to be able to take the data from what we accomplish and be able to demonstrate through data that we have been able to save taxpayer money by not having seniors unnecessarily go to that highest level of care because they bypassed the full support that was available proactively to them. If we are able to do that and the theory proves right and we know prevention works, so I'm not going to argue that piece necessarily, it's just about can a coordinated system that's integrated have a meaningful impact for seniors? My theory and the collaborative that's agreed to be part of this is all yes. So what I would ask is, in your respective agencies, if you'll take a look at this, and if the task force would be able to take a look at this concept and evaluate whether this is valuable enough as a go for it, and think about supporting our application for that next 50 grant. There's only one that's going to be selected in the entire state of Colorado, and I want it to be here because I think our seniors matter, and Silver Key is such a unique organization in that we serve 7,000 seniors in this community alone, and through that we know 70% of the seniors that we serve are very low and low income, which means that when they were 64, if their income situation hadn't changed, they qualified for that full benefit then. What I want to do is make sure that we put together a model of care that's going to be able to move people from unwell to well proactively, intentionally, and really be what I think the state of Colorado wants, which is a healthy place to age and to be as independent as you choose to be. My time is almost up. I did request, because it's a collaborative grant that we have collaborations, we have 8 minutes. So I just want to summarize by saying thank you for listening. Seniors matter, and I think unfortunately what's happened, a lot of seniors in our communities only become visible when it's at the end of life. I'm saying let's make people visible before we get to that level of need. Thank you, and Summer, I appreciate it.